Okay. Call the meeting to order. And Maureen, I guess this is not your first meeting, but it's first meeting. I think I've been with you or not. Maybe you were not. Your picture wasn't last time. I can't remember. But welcome. You're on mute. You're on mute.
Maureen, can't hear you.
No, she knows. She
Oh,
wants to be.
okay. Okay. Oh, I see. So she's purposely muted. Okay.
All right. Let's see. I'm going to bring up the agenda. I don't think I can share it.
Whoever the host is, which I think is cable TV, would have to give you permission.
Yeah, sorry, I'll do that right now. Who is it for? John?
Yeah.
Yes.
Okay. Okay, should be all set now.
Okay. So first, we have 2 sets of minutes to review. Do I hear any comments? April 8th and May 20th?
I looked at them. The only comment I have was, and I can't even remember what it was, that I just think it needs they both need a spell check. I don't even remember the misspelling I found, but that's all. That's my comment.
Okay.
That was fine.
Look into it.
I move that we approve the minutes of both meetings.
I second.
All in favor?
Aye.
Aye. So, and the, Larry, the June meetings, minutes will be next time?
Yes, it is going to be extremely short, Dr. Strauss, because it's going to say meeting was not held for lack of quorum.
Oh.
Rich was on, but he had technical difficulties.
Something happened with my internet connection. Yeah, it was terrible.
All right. So we probably officially ought to approve it next time. That'd be great.
Yes.
Okay. I don't think we see any to make public comments. And we at least know from our experience with the during when we talked about the COVID
Face covering.
that we do certainly can get public involved on these Zoom meetings. So
Yes.
the fact that we don't have anyone tonight, I think, just goes back to our usual status. Okay, Larry, in terms of COVID-19 issues?
So we have had 426 cases in total, 23 of which have been fatal. 419 have recovered, so we only have 7 cases. Over the past week or so, we have seen marked decreases in the number of cases that are being given to us or cases that are reported as being positive in Watertown, which is a good thing. I don't know if you had seen my interview with the Watertown News, but my biggest fear right now is that complacency would set in. We have had very good mask compliance, but I'm starting to see a downward trend in that face covering compliance because it's warmer, one, and because we're reopening and with other things, I believe that we're all starting to believe that everything's okay and we shouldn't be protecting ourselves. Of course, there are those who deliberately choose not to wear face coverings and they put the community at risk. We are in phase 3, stage 1 right now. The Commissioner of Public Health has rescinded her order around groceries. So it means that you can once more go in with your reusable bag to purchase your groceries. It also means that plastic bags cannot be used, and there are no limitations on the number of persons in supermarkets per those orders. Everyone now has to follow the guidance that has been issued by the Reopening Commission.
But now people still need to wear masks and be 6 feet apart in the supermarkets.
That is correct. That is still the guidance. And we as a department,
So Larry,
go ahead, Dr. Strauss, I'm
go
sorry.
ahead. No, go ahead, finish.
I said we, as a department, we've been trying to put out as much messaging as we can. We are eternally grateful to our students who are with the academic health partners for developing a lot of content for us to post on our social media account. And our inspector, Deanna Mazzina, she has really been leading the charge on that, as I've asked her to be the point person in posting all our social media information.
Larry, can you speak to the contact tracing in our town? How that's being done and by whom?
We are doing the contact tracing right now. We have had very few cases. We have had significant challenges with the Commonwealth provided contact tracing program. Part of the big challenge was feedback and communication, and the two systems that were supposed to be linking and providing information seems to still have integral problems. I know there is a working group that is working forward, and I've had some discussions with other local partners. So we're thinking about how can we do this better if, as we do expect, we see new cases. And it's all about learning from what was done at the height of the COVID epidemic when we were facing it here in Massachusetts, and making changes. I know that partners in health have reduced their work staff significantly because of the really good work that was done around suppressing the number of cases. So there was not a need to carry such a huge staff. I can't speak to what will happen in future. That will probably be dependent on funding and the relationship between partners in health and the Commonwealth.
So who is doing the contact tracing for us, for Watertown?
Will Van Dinter.
And he's doing it by himself? Does he have the support?
That is correct. I don't know if you're aware, but if we do not flag our cases by 9 p.m., I believe, they're automatically sent to the Partners in Health contact tracing team. And we try to flag those and do them in-house.
And so Larry, if we'll get more cases in the fall, if things get worse as may happen, how will the department handle that need for additional person power?
We will probably go back and work with Partners in Health or some other entity to assist us. We have very minimal funding to support that, but I think that is a bridge I will have to cross when I come to it, as far as funding goes.
Okay.
I can tell you though that given all that we've seen in town, we had gotten some grant funding, some of which we still have. And we hope that if things change in the fall, that we will have the ability to do that. There are two sets of funding streams that are out there. One, some grant funding we had gotten from the Commonwealth as a region, and then each city and town got a piece of that. And then there's a CARES Act funding that is out there right now.
So would that allow you to hire additional staff and keep it in-house?
Yes, it will, because we did have a retired public health nurse, Fran Nelligan, and an EMT who worked with us to do most of our contact tracing.
That's great. So Will made very good comments in the Globe. I don't know if everyone saw those or not.
Yeah, very good.
Yeah.
Yeah, they were extremely honest comments. You know, the challenge that was faced is that you had a program that was expected to stand up and take on a huge bite immediately. But before they did that, what they should have had was a consultation with the local boards of health who were on the front line of doing this and who knew what was happening in their communities so that it could have been better done. I think that there's a lot of lessons to be learned from this experience.
You would think as an organization, Partners of Health, with all their international experience, would have been more keyed in to talking to the local people first.
Yeah, we would have hoped so, but
I have another question. You quoted the number of cases and deaths in Watertown. Percentage-wise, how many of those people that died were in nursing home or congregate housing? Is there a correlation with their higher risk, et cetera?
yeah, I think that the fatalities were, I would say about 80%, and I not having that exact data in front of me to put the numbers together for you. So this is an educated guess. I would say about 80% of the fatalities were individuals living in either nursing homes or in some type of congregate setting. Many of them too had comorbidities.
Were there any particular sites that had an inordinate amount that would raise a flag, if you will?
Yes.
Okay, and they're being looked at.
Yeah, we have already worked out all the challenges that we've had, because one has to realize that everything was being done on the fly, and we had to work with them as we went through this process. So it was a challenge, but I feel safe now that we do have a really good system in place, because once we started working with them in conjunction with the Department of Public Health, I think we got a good grasp on reducing the spread of COVID-19 within the facility.
And I think the state has worked very hard to work with those facilities.
Yes.
To bring them up to snuff. Larry, when you mentioned that you're noticing some slacking and people wearing masks, do you think that's inside or outside? You're probably observing mostly outside, but are we having problems inside too?
I have not been in many places. Most of my observations are outside. However, what I can say is that many of the establishments are extremely adamant about service and entry into their facilities.
Yeah.
And they've adopted the no mask, no service policy. You're not wearing a face covering, don't come into our building.
That's really good, but I just hope the town is supporting them. I know some places have found it. They get very angry customers and when they say that. And um,
We, as I don't know if you remember, but initially when the order was passed, we had provided a number of posters for the establishments to put on their door, which indicated that entry into the establishment requires wearing of some type of face covering.
great.
So,
I have
so
been
now,
around town.
so we're in like phase 3, correct? That started.
That is correct.
And that allows dining inside of restaurants, etc.
That is correct. It allows indoor dining. It allows increased capacities for both outdoor events. So people who had planned their small intimate weddings can go ahead with some of those. It allows for increased use of play parks. Right now, the town has opened up both its splash pads, of course, albeit with reduced capacities, because the numbers are reduced based on their square footage. However, the capacities are a lot better than we had before. So it's way beyond the minimum 10 person, and then that went to 25, and now in some cases it's up to 100.
Now,
Do you
is
have
the
are any of our churches opening?
Not to my knowledge. Some of the churches have been opened. I do not follow the churches in Watertown per se, but the guidance is that as long as you can maintain the social distancing and the wearing of face coverings, that capacity for them has increased right now.
Yeah. I was just wondering if any had carried through on that.
Yeah, what I have seen in other communities is some of the churches have gone to an appointment system where their residents are asked to book a seat at church. So if you turn up wanting to go to church that Sunday or Saturday evening, you have to wait until everyone who has made a reservation come in, and then if there are any slots left, then you can go in up to the maximum capacity.
regarding the indoor dining again, is the health department now being tasked with monitoring and enforcement? And if so, are we staffed appropriately to do that level of monitoring and enforcement?
We're being tasked with doing everything, Richard.
Yeah.
What I can say, and I really want to be as diplomatic as possible with my response, is that departments outside of the Massachusetts Department of Public Health have been tasked with a lot of the concerns and issuing guidelines around reopening. I am unaware if public health even has a seat at the table in guiding these. So, for example, we are being asked by the Department of Early Education they're asking their daycares to call us and when they're reopening and inform us, and I'm still trying to figure out. I know I missed a phone call yesterday because I was at an all-day NEHA board meeting, and I understand there was some guidance around that, and they will be on the phone call on Friday, and I hope we get an answer. But they're saying they have to call us, but we don't know why. So what we're doing is we're just logging that this person called us. We're aware. And it is taking up time from staff. The restaurants are within our regulatory ambit. So we can address those concerns. However, the seating capacities and the number of patrons there, we really do not have any issues on it. The other challenge we face around this is that a lot of it is structured around guidelines, and within the guidelines, instead of saying that shall, they're saying should, and when you should do something, it also means that you don't have to. So that is a
Right.
challenge we are facing. As for staffing, right now we're doing okay. I hope within the next week, and I'll bring this up later on. We have had interviews for our second health officer vacancy, and they're doing the HR is doing background checks right now.
So Larry, are you saying that if you go into a restaurant and people aren't 6 feet apart or masked, that there's no mechanism for a fine because these are guidelines and not requirements?
That is correct. And the way it's structured is we have to tell them, you've been naughty, you need to separate these things out, and please do so. And we have to leave. The second time we come in and we see the situation existing, then we say, you're naughty and you really need to correct this, and I will have to send you a warning. And then we send them a warning notice. The third time is when we can actively take any action. However, when you're informing people that you should do something, then there's no action we can take because they should. And it also means if they don't, we can't enforce a should.
So that means you can give them a warning, but you can't stop their operation.
That is correct.
Well, it sounds like 3 strikes and you're out. At some point, we do have the ability to have higher level of enforcement, or no?
That is yes or no, because it all depends on if it's a shall, then 3 strikes and you're out. If it's a should, there's nothing we can do.
Well, let's, if we start to see that, we can do things like publicize it, but would not be, let's hope we don't have to get there.
Well,
I wonder, I'm sorry, I just have to ask. At my university, we're dealing with mandating flu vaccines. And I bring that up because our legal department was struggling with, requiring versus recommending. And there is verbiage, and maybe I can find it again, that if an activity poses a public threat to the health or wellness, you can step in, and it's generic. It doesn't have to do specifically with COVID-19. But I would imagine that could be interpreted as such. If you have people gathering, to a point where it causes risk, we probably have some level of ability to step in.
We do have some authority under Chapter 1 of the State Sanitary Code, and it is exactly as you just described. If we perceive that there is a risk to the public health, then we can take action accordingly. So there is that out. However, when a reference to a guideline says you shall or you should, it is extremely difficult to defend action on shoulds because we have to build an extreme case that shows why we have to take this action.
I think what he's saying is it's different with a known infectious disease where you know exactly what the risk is, but people are, this is all, you can't go to chapter and verse in some regulation and say this is what, or even a study. I mean, it's just, I mean, if there's not somewhere where it's written down that that's bad for your health,
Yeah.
it's
I
just,
guess it says that in a way we need to enlist the public support, because I know if I went to a restaurant and I saw people not wearing masks, or I guess we don't have bars right now, but the waiters not wearing masks, I would be pretty upset. So I think that one thing is to really keep trying to normalize the wearing of masks so that the public also becomes part of the enforcement process.
And that is the exact approach we have taken by educating our public on what the requirements are. And we do get feedback, and we reach out to businesses. Hey, what is happening here? You know, you're required to do this. So the
so Barbara,
public,
that's what I was saying. I think if we ever got to the point where some establishment was really trying to not cooperate, we would have the obligation to make sure the public knew that they were at risk.
absolutely.
It's hard depending on the public, by the way. I was in a large box business that borders Watertown, I'll say that much. And I was purchasing something at a deli counter. And the fellow behind the counter was wearing a mask, but it was down below his nose. His nose was totally exposed. And I didn't feel comfortable calling him out on it, if you will. I didn't think I should do that. But yet, you know, that's very concerning. He's there slicing meat and breathing right over your food and over the counter. And, you know, I think asking the public to help enforce is very limited, and also it can cause confrontations that you don't want to encourage either. So unfortunately, people tend to just be quiet and let things go by.
Rich, I wasn't thinking of the public enforcing. I was thinking of the public being notified. And
Oh yeah, for sure. Yeah.
To not
Public shaming is that
public shaming, not to use that institution or establishment.
Yeah.
Yeah, the power of the purse is an extremely effective power. And what we have done when we have had complaints is have discussions with management. Also, on an individual basis, if I go into a place and they're not adhering to the guidelines and putting me at risk, I make an about turn. And I also find the customer service desk and say, may I speak to the manager? And tell the manager, I am leaving. And the reason why I'm leaving is because of X. You know, and until this thing is over, I'm not coming back.
And if we put that in the tab, enough people would stay away from that organization, they would think twice.
Mm-hmm.
Yeah, if you happen to subscribe to, was it Nextdoor website or whatever that listserv is,
Yeah.
many of this type of feedback flies there, and that's just one social media area where something like that could be displayed. Certainly.
Let's hope we don't have to get there.
Right.
Yeah, I really prefer to go around the education and discussion line as against public shaming.
Okay.
So for right now, you're saying that we are successfully managing the current COVID pandemic within our borders. We have contact tracing. We have sufficient staff right now to handle that and do the appropriate monitoring and isolation and quarantining.
That is correct. In to this current circumstances, when we were at the height of it, we were severely understaffed, and that did present challenges for us. However, when we had gotten some funding and we were able to bring on some contracted staff, it helped.
So one last question. Do we have any potential, we don't obviously have a beach, any places that would be, are people are staying off the playgrounds as asked?
People right now, they're allowed to go onto the playgrounds, and they are. Many people haven't, and that presents a huge challenge. For example, you're not allowed to be engaging in contact sports, and there's a group that goes to the basketball courts behind the Boys and Girls Club. When I was leaving at 5:15 this evening, they were there with a full-blown basketball game going on.
So what's the town's response to that?
Well, I've asked for assistance. I've provided the information to both the recreation department and the police department. And I cannot regulate that.
Is that the Watertown Summer Recreation League that plays there
No,
every
no,
summer?
no. These
Okay,
are pickup
alright.
games.
Yeah,
Okay. Yeah.
I see small pickup soccer games like that at the, the track on Orchard Street, and then there's this central place where
Yeah.
you play soccer. I see small pickup soccer games like that. They're not wearing masks. I mean, at least they're outside and there's some wind, but they're not wearing masks, and they're not all with boys 16.
That's exactly it. There's a group of the invincible who believe that they will never get sick and they don't have any cause to take any precautions. It's impinging on their ability to enjoy themselves, not thinking that their actions are impacting a significant part of the population. So for me, it's simple selfishness. I cannot describe it otherwise.
But I think it would be difficult for the health department to do anything about that because they're so random. It's not like a restaurant where you can go in and it's always in the same place.
Right, that is exactly it. And that is a challenge as a municipality we're facing because it's happening there, it's happening out there. And unless you're in every place at the same time, it is difficult. It's the same thing like the challenge we face around dogs. People let their dogs loose in the parks. We have 2 dog parks, which people go up to Filipello, and instead of using the dog parks, they go on the soccer field and let their dogs loose.
So is our current protocol that we would respond to a phone call if a concerned citizen calls and says, there's a bunch of people gathered here without masks? Are we expected then to respond to calls like that?
The guideline comes from the Department of Energy and Environmental Affairs, and I refer to them. I do not have the resources to make that type of response, and it is not safe for me or my staff to be making that response. I also forward my concerns to the police department and to the recreation department.
You see, if they were at least wearing masks, you might let them sneak by, but just totally flouting everything is just very worrisome.
Yeah, there's a lot of that going on.
But as Barbara says, at least it's outside.
Yes. I'm happy that people have been able to come out because, from a mental health perspective, being locked up, not being able to go out and engage in recreational activities does place a lot of stress on the individual, especially for one who is extremely active. And even for someone who has not been active, but not being able to go and take a walk around the park, it is a challenge. So I am happy that we are able to allow these things. They're allowed team practices for softball and baseball. They're allowing drills, but no active contact. So there is some activity that is happening. And yes, we're happy to see that.
Yeah, I agree. Okay. Move on to the next item, which is staff updates.
So staff updates, as I mentioned before, we have conducted our final interviews and made a recommendation for the hire of a health officer, and it is now going through the check process. Once those are completed, a recommendation would be made to the town manager for a conditional offer.
This is replacing Erin's position.
That is correct.
Great.
And is this person that we're interested in able to start quickly?
Yes, the person is actually working as a health agent in another community, so they do have some experience coming in.
And but they'd be able to join like 2 weeks after the offer or something like that.
That is correct. Because I've asked that question, and the individual had indicated to me I need to give 2 weeks notice to my current employers.
Great.
I know, John, we moved down a bit, but we, under the COVID-19 discussion, we wanted to discuss the stressors involved with people who have substance use and other type of disorders. And so we can have some discussions around that.
Yeah. It came up at the last Watertown Substance Use Coalition meeting that, and Larry, I wasn't quite sure whose data it was, that even though the police contacts and for substance use, particularly opiates, has gone down, and we're under what we were last year in terms of Narcan applications and calls. There is a increase in suicides.
There's police data.
That's
Yes.
was that data specific to Watertown actually, or just in
No,
general?
no, in general.
And so it occurred to both Larry and I that might be something that in the future we want to think a little bit about what the stress of presumably COVID is doing to folks who for all sorts of reasons are under increased stress, not necessarily from the disease itself, but certainly from the results of either loss of job or being inside or multiple stressors that are out there at the moment.
Yeah, and social isolation to a large degree.
Social isolation.
I think it's been especially difficult for working parents with young kids. I mean, it's just not a feasible arrangement for many of them, especially if the schools aren't going to open at, a capacity that's going to be helpful for them.
And, Barbara, that's if you have two parents. Think about being a single parent and trying to work and supervise your kids to be in school. It's almost impossible.
So is there some type of support that the town can offer? Is there is there a message that can go out? Again, if you are feeling anxiety, stress, depression related to the current pandemic, please be aware that these services are available to you. Something along that line.
Right. Right now, we're working on something like that, and part of the rationale for this discussion too was the police department has had another position funded for a psychologist on staff, so, or a clinical outreach person, a social worker, sorry. So they've funded another social worker in the police department, so that helps expand their ability to respond to these type of situations. We also have our own support social worker who supports everything in the community, as well as there's another social worker over at the senior center who does work specifically around our population that is served by the senior center.
So the social worker that the police department has, what population will that social worker work with in contrast to the population that the health department works with?
They're both going to be servicing the entire population. However, the social workers the social worker we have provides a wider range of services by appointment and provides guidance to people. The social workers at the PD, they respond to emergency calls and assist in those calls. So for example, we may have a call for an OD and they go out, but then they will have outreach to both the families and follow up with the case themselves and try to guide them to treatment. Right now, as we noted, they may respond to a suicide call and go out. That social worker would be working with the case and the families to assist in resolving the issues around that. So they respond to emergencies and we do routine work.
Okay.
So, I mean, unless the opiate calls change, I think it gives them more opportunity to be involved with diversion, what they call diversionary calls, where there's a mental health issue, whether it's suicide or psychosis or senility. They can approach that without using police as much police. Police still go out and accompany them, make sure they're safe, but at least they can intervene in a less police
Aggressive.
Right. Yeah, and that is absolutely correct. They will be able to better respond to these type of emergencies. And it's based around mental health concerns for the individual.
Yeah.
And of course, substance use concerns. We, however, our social services provide a whole range of services. For example, if you need to get on WIC or Mass Health or any of those social network services, they provide those services to them. If you need assistance with getting legal aid or something, or you have issues with an eviction and you believe that you're being treated unfairly, the social worker would do that. If you have challenges around food security, provide you information with where you can go. If you so there's a whole huge range of services that individual provides.
Well, this hire from the police department, a couple of thoughts. It's probably obviously not more than a 40-hour-a-week position, but these types of emergencies are 24/7. And so I think it's great if they recognize that need and they've invested in having somebody that's able to go out on a call. But obviously that's going to be limited to certain hours of the week. So it doesn't really fully
It's not,
meet that
Rich,
need.
they have it, having two now, they do spread, I'm not sure exactly what their hours, but it's not just 8 to 5.
Oh, so they have two. They have two people doing it. Good.
Yes.
Okay. And the other question, just as a question for the group, was this recent addition in response to the upheaval around police brutality and their inability to deal with these complex issues when they go out on these calls, or was this preceding that?
The request was brought at the budget hearing. So I believe the police chief saw an opportunity to improve and increase services to individuals who are having these challenges. There were a number of people commenting. In fact, they wanted to strip monies out of the police department and place it in the health department, so we will hire mental health clinicians. The police department said that they would love to increase their mental health services. Remember, they're on duty 24 hours a day. And a lot of what was thrown at police collectively, I don't think in Watertown we face similar challenges. I think the police chief had put out a really great statement on what we have done as a department and as a community to address these challenges. In Watertown, you are more likely to have an officer asking you, how may I assist you, than putting you in handcuffs.
I think, unfortunately, that probably reflects some racism, but we're not going to, we just, that's the way it is. And, I mean, that's what people in Black communities would say, is that police offer different, and we're obviously not, we have a very small Black population. So but it's still, it's nice, we have the opportunity to do the right thing. Larry, I wonder if some point, maybe even you jointly with the police chief should put out something through the tab and the media about the resources that are available.
Sure, I can discuss with him, and we can that is definitely a great opportunity, because I think that the challenge you always face is while you're doing, there's not enough time for you to tell.
Yeah.
So you end up doing the work, but you don't have the time to really tell your story.
But I haven't seen, correct me if I'm wrong, but I haven't seen, at least in the tab, any mention of that of the beginning of the second position in the police department. So it's a good opportunity.
Yeah.
Yeah.
I didn't even know there was a first position.
Yes, there's been a first position for a long, long time.
Yeah. And it was funded really around the jail diversion program. So instead of, and Watertown was, I believe, the first community, or very early starter in this, where instead of sending people to prison or through the judicial system, give them an opportunity to get treatment and recover.
So Barbara, we were lucky that the state is divided into emergency service for mental health crises. It's divided into emergency service program regions. And we were lucky that the agency that was responsible for Watertown and the surrounding communities was advocates. And they very early got a grant from the Department of Mental Health to work on police diversion. So they've been doing this for years. And we've actually been, Watertown has been lucky to have that service.
Yeah, that sounds really
And
positive.
they actually, for a while, they were actually employees of advocates assigned to the police department. And now the town has built that into their budget. So I think for the first few years, they actually were on a grant from the Department of Health to advocates, and then with placement of people in the police departments. So it's a great service.
Yeah, and I just got our quarterly report from the social services provider, which I will forward to you after I've had the opportunity to read it. In fact, maybe I should just forward it to you tomorrow, because it's not going to change anything. It's her report.
That's great. Thank you. Any other issues tonight?
No.
Can we, I'm curious to see about the farmer's market, how it's been doing, how it's received, the whole setup now in the face of the pandemic. Is it working, et cetera, et cetera? I'd love to hear if you have any information.
Okay, I can update you on that. It is working well. Dick's, every time I look at them, they're sold out early, but not too early. So, because they're really trying to gauge the amount of people coming, we have not had any negative feedback on the new layout and the challenges that we're facing. People do understand that things are not normal. So they do come. There's always good responses from our shoppers. We also have the hip that the match for people who have the hip card. So it is well attended. If you, I'm sorry.
Sorry, go on, Larry. I was raising another topic.
Yeah, if you come to the market late in the early in the afternoon, that line, the layout, Stephanie really did a lot of work. I had advised her on some options, but she's done a lot of yeoman work on that. And right now, to get into where Dick's is, on where the flags are, if the line gets long, it goes down into the Memorial Park area. So you enter in one side and come around. And I know they're looking to move the tent, the market tent, from where it is and relocate it and have another vendor out there. So things are moving along. It's, as I said, I have not heard any negatives, and Stephanie does an amazing job with it.
That's nice to hear.
Great, good to hear, yeah.
I was wondering, what are we hearing about hoarders? It seems like it's been kind of quiet, and yet I remember a few years ago, we had a lot of issues dealing with hoarders. And has that diminished over time, or do you think we're not hearing about it as much?
I think it is somewhat diminishing because the task force is doing its work. However, there are still problems, and we do have to address the concerns because it's a mental health illness. We try to provide as much services as we can. The other thing you have is some people moving out of town, some people passing away. We recently had one in the building next to you, John.
Yeah.
There was a hoarder living there, and that was a huge challenge, but he was eventually evicted and he moved out of town.
But I think the task force, I assume because as Barbara says, it used to be we'd have to end up having some hearings to enforce someone to move or to be evicted and or clean up. And we haven't, the task force must be doing its work because we haven't needed to use our authority in a while.
Mhm. And what we've been doing is when a property is condemned, it's posted, then we work with the building owner and the individual. A lot of times we run into these situations when someone has a medical emergency and the fire department calls us, and we go out and we observe the situation, and then we call Springwell. We have had situations where Springwell has not really been as responsive as they should be. We've had ongoing cases, so it's been a challenge at times, but we try to manage it in. If we've condemned a property and they appeal it, then it would come to you.
Okay. Barbara, any further questions on that?
Any update on the Arsenal Yards where they're at? And there's a movie theater in there. We're in phase 3. Apparently they could operate if they wanted to, etc.
Yeah, there's restaurants and there are more restaurants coming at the Arsenal Yards. Of course, the Life Sciences building, and they're in rapid construction there. It was a good thing that they were able to continue construction throughout. Ben & Jerry's is open, CityWorks is open, the movie theater is open. So that block is starting to come together.
We have
And
a
then the
movie
next,
theater that's
yes, we do.
movies.
A multiplex.
Just here, right next to CityWorks. So you can go look at a movie and come out afterwards and have some ice cream or go have dinner at CityWorks.
Or beer.
Yeah. They have a number of beers on tap.
So they're moving along and they are opening all these establishments.
Yes, they are. It's a wonderful project to see moving forward. I know that when I had started looking, they had just started looking at the area between CityWorks and where the hotel is. That hotel, I think they should be starting all the internal work shortly, and the other building should be going up there. The building behind where Ben & Jerry's is, that is going up with the garage, and the residential building way behind is going to be in the last phase.
And the other real estate piece, the Mount Auburn Health Club or whatever it is over by the river, they have
They've closed
hands.
they've closed and the property has been sold. From what I understand, there is most likely going to be a Life Sciences building coming there. Tufts has been sold as well.
Oh, yeah, right.
Yeah, they're moving out because remember they joined with Harvard Pilgrim, so they're moving out and combining their operations.
But that's, as I understand it, that's a swap. The folks that are out where they're moving are going to move back, are moving into that building. So that's
Okay, so
not going to be empty.
no, it's not going to be empty. There's going to be Life Science. It's going to be converted into Life Sciences,
Right.
as against offices there.
So with these new developments, our guidelines for research facilities is very timely.
Absolutely, and we did have $10,000 added to our budget this year for a consultant.
So,
to assist.
that-
The
I'm sorry.
fire chief has made his recommendation to the board, to the town manager for representative on the Watertown Biosafety Committee. John, you and I have to make decisions on whether or not we're going to sit on it or nominate someone. I will most likely ask Raj to do it, or and I know that Dr. McManus has submitted a couple names to us. I will forward them to you
Okay.
for people who are interested in serving on the Biosafety Committee.
And what kind of feedback have you heard from the local labs as to the regulations?
It has been positive. I've had a meeting with the community that is going in at Arsenal Yards. Most people had questions. They wanted to know what their needs are, what they would have to do, what the process is. A lot of it was around level 2, and they're just doing simple stuff. And I said, you know, it is within the regulations. You really have to go through the applications. And if you make, if on review, the committee finds that you've applied for level 3 and you have to be licensed, but your operations do not meet the licensure criteria, then they'll bump you down to the registration criteria, and vice versa. If you submit and you should be licensed as against registered, then it will happen. But I can say that our regulation was really well written, and it's really the operational guidelines and what the process for licensure is going to be.
Can you remind me the dates that we're now doing?
July 1. So it's effective right now.
And they, yeah.
I've received inquiries from individuals, and everything is posted online, the regulations, the FAQs, the, what do you call it? The applications.
And they have how long to come to submit and come into compliance?
Existing establishments, 1 year. Any establishment that is being constructed after today, then after July 1, then they would have to apply for licensure.
So we better get the board going, huh?
Yeah.
Okay.
I will submit the names, and then at next month's meeting,
We can
I
approve
will
them.
invite them to attend, and we can interview them and make some appointments.
So
Will we see their CVs prior to that?
Yes.
So Larry, I'm around anytime the next few days if you want to talk about how we should handle the appointments.
Okay, so what I will do is let me send you what Heather has provided to me.
Yeah.
And we can chat about it once you've had an opportunity to look at it, John.
Okay, super. That's great. Good meeting.
Right. Typically, the board does not meet in August, but given all the delays and everything else around COVID-19 and the ease in having meetings with Zoom, unless they rescind the ability for us to do this, are you willing to have, do you think you want to have a meeting in August, or?
I think it's a great idea, especially if we can get the biohazard board set up.
Mm-hmm. Yeah. Again, great, Rich. So that remember, it's the 3rd Wednesday in August. I can give you that date now because Watertown Cable Access has already booked all those dates out for us.
So that's August 19th.
19th, correct.
I may not be available, and I won't know for a while that as to that date. I might have a remote deposition. So
Okay.
I have to
Do you
hold
have
it.
to actually travel for?
Oh, it'll, there, I've had colleagues who have done Zoom depositions, and they'll even have documents sent to them electronically to review at the deposition, and apparently it works pretty well.
Good.
I don't think it's, in all honesty, I don't think it's the same thing as if you're there face to face. But I think given that it's, who's going to want to get on a plane and, fly to Pittsburgh right now?
Yeah. Okay. Well, let's try and plan that. And Barbara, we hope you can make it. And again, if we had to make it at 8 instead of 7, I think, we could do that too. So see what your schedule looks like in terms of.
Yes, I'm going to put it in, and then, I'll just see how it's looking.
I put a hold the date on my calendar, so I'll just wait for a confirmation.
I think you can consider it confirmed right now. If we have to make adjustments with the time and push it back an hour, we can do that as we get a better idea from Dr. Beck on what her availability is. But let's just go with the next meeting is going to be on August 19th at 7 p.m.
Okay.
Okay. And good luck with your new staff person. Hopefully you'll be on board by then.
If hopefully she'll be on board back then, so I'll have the opportunity to introduce her to you.
Yeah, that'd be great. So we would ask you to invite her.
Absolutely, I will.
Thanks.
All right.
All
Thank
right.
you very much.
We adjourned.
Meeting adjourned. Thanks, everybody.
Have a good night.
Good night.
Night.
Thank you, Maureen.